I think we could touch on a few of these. I think the first one is many people underestimate the effect of environmental pollutants. There was a study done in London looking at 18,000 people and showing that people who lived very close to the highways or the motorways, actually their incidence of dementia was significantly higher than people who lived much further out as you go towards the countryside. So I think that's something we have to take into account. But it's not a question of saying, well, I'm okay because I travel less. There are precise ways that we can measure this. We can actually look at somebody's exposure to heavy metals, that's what's embedded in their tissues. Yeah. And actually there are ways we can remove it. So I think it's everyone, the message that we want to give everyone is we could go around this circle and we can measure precisely what's affecting each individual, because our standard approach in treatment patients is to give everybody the same treatments and say, well, someone who has, let's say, Parkinson's, you get the same drugs. Yeah. But I think that the approach we're taking is a personalized precision approach. That is, measure each person's own, find the root causes, and then correct those. So we have an approach where we can measure and we can see the improvements that occur.
I mean, the most dramatic example for me of this circle is I have a home in Scotland, I have a home in England. My Scottish home is a place called Helensburgh, which is about 20 miles outside Glasgow. And the life expectancy, if you're a male living in the middle of Glasgow, in the East End of Glasgow specifically, amazingly is 57. And there's a railway line between the middle of Glasgow and where I live, my house there. And for each mile you got the railway line, life expectancy increases by 2 years. Because of environmental factors. Many people in the East End smoke, they drink far too much, they go on holiday once a year, don't use any sun cream and burn themselves to death, etc. So I can just see, and their diet is atrocious. It's all fatty meats, and so I know that. I can see it. So inflammation, sometimes good, sometimes bad.
Correct, yes.
So what would you say about this environment?
Well, I think that this is essentially, the analogy here is that this is a pristine environment. That is, we cannot look inside of our bodies unless we do particular types of tests, which we don't normally do unless there's a problem. But the message here is really consider our bodies like the inside of a house. Yeah. When our immune system is working well, we have the immune system is like a control valve, like the fire. If we need more fire, so let's say cook, we'll turn the fire up, and we get more of a flame. But it's controlled. The immune system is like that. So we have a virus. Let's say somebody gets exposed to the coronavirus. The coronavirus, if their immune system is working well, what will happen is they'll get acute inflammation. They'll feel the symptoms. But 14 days later, those symptoms will go away because their immune system has actually taken care of the virus, killed the virus. But they've still experienced that inflammation, that's acute inflammation. And those are the symptoms they feel, the tiredness, what we call the flu-like symptoms. That's if the immune system is working well. And we could show other examples of the same thing.
Sure, so just to make sure I've got it, a normal person that gets some sort of infection, you use the example of the coronavirus, the immune system comes into play, kills it, but in order to do that, it needs controlled heat, it needs controlled inflammation, which in this analogy is like the cooker in a kitchen. However, I can see in this one, the kitchen's caught fire.
That's the case of somebody whose immune system is not working well. Now, what happens is the fire is uncontrolled. It burns and it causes damage. And again, this is the living room. You have the same situation. A normal individual, the fire goes up, creates heat. We need that.
So these could be individual organs. I mean, this could be the fireplace could be my gut, for instance.
Correct. Yes.
So a normal person will have inflammation in the gut from time to time. Mine, at times in the past, my total gut was caught fire. Now, in extremis, I've now got the hang of this. In extremis, the body is like a house. We want it to be a beautiful house. But if the immune system gets out of control or isn't maintained properly, the whole house burns down.
That's what we call chronic inflammation. And if you go back to the previous slides,
I think that's what we call dead.
On the way. And that's chronic fire. chronic burn, and that's what goes on internally with any diseases, cancers, any of the diseases we put on this
But
previous
if your whole
slide.
body's on fire, you've now got multiple significant issues.
Right, just like the house, we know that our lifespan is considerably shortened.
Yeah, indeed. Okay, so as long as your immune system's in good condition, it's going to carry on doing its job. It'll control the inflammation and you'll age healthily.
Right.
But if, like many, your immune system is damaged, can it be repaired? Because I didn't know that. And I'm far from the most intelligent person in the world, but I'm not the most stupid either. So if I didn't know it, I think there's an excellent chance that many, many people don't know it either.
Yes, and I think that that's one of the advantages we have is that, remember, so with engineering programs where we were one of the first groups to be able to take people who, you remember the house that was on fire? People, that's like somebody has a cancer, a very severe cancer where they know they're going to die.